ASCP 2013 Chicago, a week filled with amazing educational opportunities, dynamic faculty, and inspiring speakers. The Honorable Hillary Rodham Clinton, a champion of human rights and opportunities for women and girls, set the stage for a global scientific conference with an inspiring keynote address.
What a spectacular meeting we've had. Over 1,500 participants this year at the 2013 annual meeting, and quite honestly, the most wide variety of educational opportunities we've ever seen at ASCP. Starting with Hillary Rodham Clinton, former Secretary of State, and obviously a change agent and a guard for all patients in the world. She had an opportunity to share with us her vision for global health, as well as a vision for making sure that domestically we have the opportunity to make big differences in pathology and laboratory medicine to effectuate changes for healthcare.
At ASCP 2013, we were lucky to have international guests to discuss firsthand their experience working with ASCP and the Society's commitment to global health.
So somebody remembered that I've mentioned ASCP before, so they called me and they said, "We need help. Do you think you can call on somebody that you know, because we have this tissue that needs to be bred?" So I called Blair and said, "My friend, we need help. I don't know how you can help, but this is it." So we set up a conversation and with the ministry personnel, and at the beginning of this year we actually had 4 pathologists. Blair Halliday was your executive vice president, your president, Dr. Schilling, and 2 other pathologists that actually came out to help with the backlog. And whilst they were there, we were able to get them to look at the lab, and I think they will expand on that tomorrow, to really look at where the problems, because you know the government picked up a phone and say, "We have a problem in terms of reading the slides." But the other problem that I was thinking of is that we do not have expertise. So you might have a government that's willing, but they do not have enough expertise to really make the right decision.
This year, the Society welcomed Dr. Stephen H. Croft as our 2013-2014 ASCP President. An active member of the ASCP community, he is poised to address issues facing the profession.
Well, I think ASCP, by virtue of the fact that we represent the entire laboratory team, is very well positioned on a number of key issues affecting pathology and laboratory medicine currently. Examples include workforce shortage issues. Again, because we do represent the entire team, we can have unique perspectives on what the kinds of demands are on our workforce, where the areas are that we need to fill in, what kind of strategies we can apply to building an appropriate and appropriately trained workforce for the future. We also, because of the diversity and size of our membership, can have high impact advocacy efforts with respect to reimbursement issues in the coming changes in healthcare financing.
ASCP has provided a diverse array of speakers, education, and resources to support you and your profession.
Next year in Tampa is going to be an absolutely extraordinary venue. We're going to bring the kinds of change agents into our pathology field, thinking beyond the lab, that will bring the members into the relevance of the medical home, but put pathology and laboratory medicine on the map as the influencers and the most important part of the decision of that patient's chart. Remember, 70% of what we do is influencing the health care of our patients. And with that, we're going to bring a dynamic team of people, not just our educators, but folks outside the laboratory, to showcase why we as a profession and why we as an organization, ASCP, we're going to bring about sustainable changes and be influencers. Tampa is going to be a can't miss event.
We'll see you at ASCP 2014, October 8th through October 11th in Tampa, Florida.